So from what you're saying, is it fair to say that if somebody says my father is 85 years old, he fell, broke his hip, and is in severe pain, any small amount of movement gives them a lot of pain? But I'm worried because he's 85 that he's too old to have surgery. You would actually say that it is perhaps safer for the person to actually have the surgery done so that they can have less pain and be mobilized rather than to do what the patient's family may think is safer, but actually is not good for them.
100%. Very well said. I couldn't say it any better. That surgery is your only way out. If you don't operate, I mean, I'm talking about an unstable fracture that needs surgery. You waiting for it or saying that age, because he doesn't have that much time. Now, if you lose that time by trying to get him to get better, tying him down to the bed, it's I I think that's doing a disservice to the patient and to yourself. There is the problem. We have this phobia of surgery, but it's like, I almost say this, it's like your house is on fire. Sometimes it's as bad as that, right? Your only option is taking a chance outside than staying in. And that is only if the patient is an extremely high risk. But generally, they're all a little bit higher risk than a 20-year-old. They have to be. But the goal is get them up, get them going, get the operation done sooner. In the US, it's the criteria is within 24 hours. In fact, you need to get these people operated upon. A patient with hip fracture, there's I think it's Medicare mandate that you do it, and then your reimbursement to the hospital is based on that too. And there are committees in every hospital to optimize the patient, change what you can change. There are some things that you can change in a patient, like their electrolytes or something like that, or reverse their Coumadin, but get them optimized, get them to the operating room, and then mobilize them.
And generally, in your experience, even in this elderly, fragile people, the results are quite encouraging.
I think so. Again, it's what you put in is what you're going to get out. So if you have an extremely sick patient before and you're doing the surgery for pain relief, then it may be a different issue, because if the patient was bed bound before and they have a fracture that can only be fixed surgically, and your goal then is essentially pain relief more than function. But I think otherwise there is no other option that you fix it, you take care of it, relieve the pain, get them up, get them moving, sooner the better.